Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences, which has to do with care of the nervous system and the brain. We'll meet three specialists who are part of the Ochsner Neurosciences Institute at St. Tammany Health System, and we'll learn about brain, spine, and pain management. We'll start first with Dr. Ben Brown. Dr. Brown, welcome.
Hi, Melissa.
Really glad to have you on the show. This is an exciting look at neurosciences, and I think an exciting advance in care in Covington to have the Ochsner Neurosciences Institute at St. Tammany Health System. So maybe start with a little bit about your background.
Sure. My name is Ben Brown. I'm a neurosurgeon. I grew up in this area on the Northshore and went through the LSU system for medical training, and then went away to Florida and did a fellowship there in a subspecialty of vascular neurosurgery, and worked there for a little while, and now I'm back and happy to be home in St. Tammany.
That's exciting. And you're part of a group that has brought neuroscience, so neurosurgery, neurology, et cetera, to Covington there at St. Tammany Health System. And I know that you all practice in all the different areas of neuroscience, but can you start us off by talking about the brain and some of the care that we're able to provide here locally?
Sure. And yeah, so I'm in a group of three on the North Shore neurosurgeons, but as you mentioned, caring for the brain and the spine, it takes a huge team of neurosurgeons, neurologists, therapists, intensive care specialists, and then the emergency personnel in the hospital. And so St. Tammany has done a great job of building kind of the full services around neuro. So from a brain standpoint, that mostly comes down to trauma, which is commonly encountered in the community, stroke, also a big deal in the community, and then things that are maybe a little less common, like brain tumors. So the common theme with all of that for people to know at home would be, the symptoms that come with something like a stroke. So like the acronym FAST.
Face, arm, speech, time, FAST.
That's right.
Yes.
So those things, if you notice facial drooping, slurred speech, arm weakness, time is of the essence and you need to get to the emergency room, that could be signs of things like a stroke, of which St. Tammany is a primary stroke center and has advanced techniques to help with that. But could also be other things like a brain hemorrhage, where neurosurgery can come into play, or things like a brain tumor.
Wow. I'm sitting here thinking about that. You know, you're sitting at home with your family, and a member of your family suddenly is unable to get their thoughts out, or you see their face drooping, you ask them to lift their limbs and they're unable to control their arms. That is the reason to call 911, thinking you have a stroke. But you're saying once we get there, maybe it isn't even a stroke, maybe it's something else. You could discover a brain tumor, all kinds of other things.
Correct. So, you start with an initial workup that's very fast in the emergency room, and then if very fast things needs to be done, they can be. Otherwise, it de-escalates to other pathways. And things that we've recently added at St. Tammany is the neurointensive care unit. So we have personnel that are dedicated to the critical care of a neuro-specific patient. Previously we had critical care services, but they cared for the broad systems in the body, all systems, but now we have a dedicated neuro unit. So people who have very complex issues with, brain hemorrhage or brain tumors can be cared for in a very specific way by a neurointensivist.
And that's, I think, a good indication of what St. Tammany and Ochsner are doing together. As we were saying, we have the Ochsner Neurosciences Institute with your offices there in the medical office building, connected by Skybridge to St. Tammany Parish Hospital, the flagship of St. Tammany Health System. And there you have operating rooms that have special technology specifically for neuro, and you have this dedicated neuro unit that has highly specialized and credentialed people who take care of neurosciences intensive care patients.
Definitely. St. Tammany's made a lot of investment in the infrastructure and the operating room for state-of-the-art sort of guidance systems for surgery. I'll be doing a surgery later today where there's a small spot in the brain that we need to get to, and we need to use sort of GPS for surgery to design our incision kind of right over the spot that we need to go to, and, so that there's as little collateral damage in getting to the objective, because obviously the normal brain we want to be, very aware of and not injure.
That is pretty fascinating stuff. That's the bright matter technology that we have invested in. And I love your reference to GPS, because I know when we bought that technology, we did a little bit of education about it for the community. And we talked about how brain surgeons have to get to the tumor, and to have that technology that helps you find the most direct pathway to that tumor for removal saves brain, and therefore can save people's speech or ability to walk, or all of those things that our brain controls for us.
Right. So it's great to have that locally here and not have to travel for patients for those things. Additionally, the cancer center that the St. Tammany Cancer Center that's opened up locally from a neurosurgery and neurocancer care, we're doing focused radiation procedures to certain tumors. So I work with a team of neuro-oncology and physicists there to work together to design plans, and we have special equipment there that can do similar laser-focused type of surgery for a tumor that's inside the brain that's maybe too dangerous to go from an open surgical technique, and we can apply focused radiation specifically to a tumor and avoid all the critical structures around that. So
that is absolutely fascinating. So, you're thinking about the Neurosciences Institute at the Medical Office Building across the Sky Bridge. The hospital has the operating rooms and the neuro ICU, and then down the street at St. Tammany Cancer Center, which is a campus of Ochsner Medical Center, you have those specialists who, in conjunction with you and your partners, are able to do intervention with radiation on, as you said, inoperable brain tumors. That is absolutely astounding. And then let me take a step back and think about what we talked about at the top of the segment, and that is, completely aside from cancer or brain surgery, stroke. You have the trauma center and the stroke center there in St. Tammany Health System's emergency department.
Right.
Well, Dr. Brown, I have to tell you, I'm sort of blown away with the level of specialty care the Ochsner Neurosciences Institute brings to St. Tammany Health System. I appreciate you coming in and teaching us a little bit about the brain aspect of it all.
Sure.
And I'm really glad to have you back home. It's good to know you're local and that you came home. That's exciting for us.
Yeah, thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences. We'll be right back.
Here at St. Tammany Health System, we're empowering our mothers, our sisters, and our daughters like never before. Throughout our entire system, we've invested in the highest level of technology available to provide more accurate diagnostics, less invasive care, and faster recoveries. Together with our partner Ochsner Health, we're giving women many ways to live stronger and better.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences. We're learning about the nervous system and the brain. We heard from Dr. Ben Brown in our first segment about brain care and about trauma. We'll hear next from Dr. Seth Hayes, a colleague in the Ochsner Neurosciences Institute at St. Tammany Health System. Dr. Hayes, welcome to the program.
Thank you.
Really excited to have you here. Maybe start first with a little bit about your background.
Sure. So I'm a neurosurgeon. I went to medical school at LSU in New Orleans, and then trained in neurosurgery for my residency at the University of Miami, where I also did a complex and minimally invasive spine fellowship.
Ooh.
Then my first practice was in North Carolina at Duke, and then we relocated back home, and been practicing here for going on about the last 5 years or so.
Outstanding.
So we've been part of kind of this build with St. Tammany and the community over the years.
Well, and I think that's one of the things that's really special about the partnership between Ochsner and St. Tammany. I think neurosciences is probably my favorite example of the partnership, because you have St. Tammany Parish Hospital, which is the flagship of St. Tammany Health System, and that is the hospital where so many people who live in West St. Tammany count on that system for their care.
Right.
And then you bring the partner Ochsner Health into the picture, and they have tertiary and quaternary care. That means highly, highly specialized care that they're able to bring into this market. And the Ochsner Neurosciences Institute is a really good example of that.
Yeah, absolutely. And I think it's great. Locally, we have our practice, and there is a high level of care that I think we've brought here with an extensive partnership, that goes beyond us and is multidisciplinary throughout St. Tammany in the health system. And at the same time, we have a lot of resources. So we have partners throughout the state, that we really are able to rely on to have, large multidisciplinary conferences that we can really bounce off consultations and, use a lot of outside knowledge and experience to be able to bring that home and keep care local.
Right, and keeping care local is the whole purpose of the partnership.
Right.
I think you mentioned that some of your advanced training when you were away from here was in minimally invasive spine surgery.
Correct.
And so maybe tell us a little bit about what that means and what you're able to do in Covington because of the technology that's here.
Yeah, so I think, from the standpoint of minimally invasive techniques and some of the technology, we've really done a great job with the partnership, and St. Tammany has put a lot of effort into acquiring the technology we need. So, for example, we have small access ports and corridors that we can use to minimize incisions and what I call collateral damage, minimizing soft tissue injury to get where we need through small ports, smaller incisions, which really leads to a lower risk of infection, need for serious things that people worry about, like blood products. And many of these technologies and techniques just lead to a quicker recovery with less general stress on the body. Wow. So some of the technology we've used, we have intraoperative CT scans and sort of like Dr. Brown has mentioned, GPS-like systems, where we can see inside the body without looking through the tissue. And so screens that allow us to use this, we've required robotics and brought kind of robotic brain and spine surgery, which has a lot of advantages and encompasses all these multifactorial techniques and technologies that we can utilize to achieve goals with patients, to minimize stress, to minimize hospital stays, and it's in my opinion very impactful.
Wow. So between the expertise that you and your partners bring and the technology and the specialized support staff that the hospital has, you have this capability there in Covington at St. Tammany that maybe in the past people might have felt they needed to travel out of town for that level of care.
Yeah, I think so, and I think it's been great. We all travel and spend a decade and years learning how to perform these techniques, but the commitment really, and I think that the sometimes undervalued piece of the puzzle is the team that we put together. So from the operating room to the clinic, to the nurses that care for patients at every aspect, from recovery to the inpatient facilities and needs, we've done a lot of effort to create a team that is specialized in caring for our particular patients, with brain and spine care and some of these minimally invasive techniques. And that really goes a long way, I think, for effective care, quality care, and really patient satisfaction. People are a lot happier when you're doing the same thing and you have such a skilled and qualified group of people doing it.
That's fantastic. And I think in the case of spine care, in the first segment we were talking more about brain, and so we were thinking about things like trauma and stroke, and not that the spine wouldn't be involved. Certainly trauma can have a lot to do with that. But I think a lot of spine care comes from chronic pain and maybe injuries or accidents that can happen to people, or things that occur over time like aging and arthritis. So can you talk a little bit about what types of patients come in and sometimes need your help?
Sure. So certainly the minority of patients on the hospital side, we deal with serious issues like cancer, infections, and more serious traumas like immediate automobile accidents that can lead to spinal column fractures and injuries. And that's one component of the job. The other component, a lot that we see in clinic on the outpatient side, is, like you mentioned, the evaluation of the never-ending arthritis. So you can have pain, right, which is very common with neck and back pain, similar to a knee. However, when you start dealing with the spinal column, there are what I call red flags, or pain plus. And that's a lot of what we do, is we screen and evaluate treatment plans, and we rule out some of the more concerning problems. And that can be simple problems, neck and back pain. Oftentimes we're able to manage with therapy or anti-inflammatories, or refer for injections and other simple strategies. And then we rule out some of the more serious forms of arthritis where we have slipped bones, or because of the overgrown joints and disc herniations and ligaments, it can encroach the canal where your spinal cord or some of your nerves live. And that's where we start talking about, pain plus. Are you having new numbness? Are you losing function in your hands and dropping mugs? Trouble with buttoning, losing balance and walking, foot dragging on the ground. So some of these problems can occur just with basic degenerative arthritis. And that's a lot of what we evaluate. Hey, this is safe. This requires imaging. Here's a problem we need to talk about. Some of it, and much of it, is still not managed with surgery, but we're able to safely educate and manage in another way. But certainly a big component of our job is to rule out these more dangerous or serious components of that. And that's where a lot of these strategies of surgical discussions, value, and a lot of the breakdown of that is kind of the summary.
Well, I think that's really maybe part of the value of having an organization as complex and as evolved as Ochsner Neurosciences Institute, to have at St. Tammany Health System a part of this group that has that capability to look at how serious is this, and do we need to be going down a path of spine surgery, and what kind of options do we have for this patient who is experiencing this maybe debilitating pain or degenerative disease in their bones or their spinal cord. And I'm envisioning the advantage being the multidisciplinary group that you're talking about. These are folks who bring different areas of expertise of neurosciences together. So you're talking to folks who work as surgeons full-time, focused on surgery, and you have folks who their areas of specialty are more in rehabilitation or in other methods and choices. And so together you can look at a case and decide, this really needs to pursue a surgery, this really doesn't need to pursue a surgery.
Oh, absolutely. And our collaboration goes very deep with primary care physicians, a lot of different care in the community. We run into a lot of unrecognized kind of spinal pathology, osteoporosis and bone mineral density issues, vitamin D levels, and these are things that a lot of the primary care teams work with us, and then more specialized bone mineral density clinics and endocrinologists, and then the collaboration between interventional pain management and physical therapy and rehab medicine, neurology. It goes very deep, and I think the advantage with a lot of these is that we're a team. We have open lines of communication. We try to work very well together, and I think we have some really high quality people that are in place, that are compassionate and make decisions that are best for the patient with the patient, based on their goals. And
Dr. Hayes, I really appreciate you coming in. This has been so educational for all of us.
Well, thank you for having us. We appreciate it, and thank you for your time.
You bet. You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about the neurosciences, and we'll be right back.
The Northshore has always marched to the beat of its own drum, and the cardiology team at St. Tammany Health System has always stayed in rhythm with the community we love so much. Here, many talented specialists and subspecialists devote themselves to providing minimally invasive cardiac surgery and the latest advancements in cardiac disease prevention. Together with our partner Ochsner Health, we're making St. Tammany hearts beat stronger.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences. We've heard a bit about surgery, particularly of brain and spine, and next we're going to talk with Dr. Nathan Harrison, who's a pain management specialist. Dr. Harrison, welcome.
Thank you, Melissa.
Really glad to have you on the show. And I think, from a pain management standpoint, I'd love for you to tell us a little bit about your background, and then I want to talk about what you do, because I think for so many of us, we may never need neurosurgery, but by gosh, pain is something all of us deal with.
Correct. So my background in pain management, I did a residency in anesthesiology at the University of Michigan, and then a fellowship to specialize in spine at University of California, Davis. And from there, I came here, and I've been here for almost 12 years. As far as pain management, back pain is probably one of the most common things that people can present to their primary care physician for. I think the incidence is almost up to 70% in our lifetime.
Wow.
So that doesn't mean that somebody has chronic pain or that anytime they have back pain that it's going to be forever. But it's very common, and so in the specialty of pain management, it's primarily neck and back spine issues, and there are things that we can do to help manage and help educate patients on what they can do for themselves and what we can do to help them improve.
Well, and I think that's one of the things that those of us who are not clinical, who maybe had a biology class in 9th grade many decades ago, the way that your body works and the way it's connected, if you have pain in your hip or in your leg or even all the way down to your feet, that can be driven from a problem in your spine.
Correct. It's very common. We see quite a few patients that present with leg pain, or they say it's my hip, and they may have seen their primary care physician or orthopedics, and it turns out it is their back. And I like to think of my role as being somebody that educates patients on what's going on and what they can do to improve that. And so we help with determining what type of studies or imaging they might need, and then what type of treatments they may need, which would include movement, physical therapy, some complementary things like chiropractic care and acupuncture to try to have improvement in their lives.
You bring up acupuncture, and I think that's really fascinating. We've done a show on dry needling,
Yes.
which St. Tammany Health System and Ochsner both have certified people here in West St. Tammany
Yes.
who do that. And that's pretty fascinating because it enables people who are already in pain to have some relief that enables them to then be able to follow an exercise regimen, learn some things about body posture, and some things that'll help them resolve those long-term pain issues.
Absolutely. Our physical therapy departments at St. Tammany and at Ochsner, they both have certified dry needling specialists, and so that is often part of the method to treat people, is that they're getting better, they may have a setback, there may be some muscular issues, and just to release some of the muscles can help go a long way. And so I think having that system there now has been fantastic for our patient population.
That's neat. And with your area of specialty, pain management specialist is your title, that's taking into consideration beyond, I'm thinking more about, we've talked with 2 neurosurgeons whose focus very much is on surgical intervention, but then your area of specialty really takes a look at whether surgery would be necessary, or if not, what some of those solutions might be, and they can be mental health support, they can be physical therapy, they can be various types of injections and interventions. And you talked about having some anesthesiology background, so you do some procedures as well.
Correct. So the role that we have in pain management is to help people from when they perhaps first get diagnosed and to decide, is this something that is going to be improved with our typical conservative treatments, or some people end up needing to have surgery, but the continuum of care between the first diagnosis and needing anything more invasive, there are different procedures that can be done that are minimally invasive, injections and different treatments in the office that often can help people. And we try to limit the need for surgery, and oftentimes we can.
Well, that's pretty fascinating. And as you said, if 70% of Americans are going to face some kind of whether chronic or long-term pain that's going to bring them in for care, that it's serious enough they can't just pop some Advil and go about their business, that suggests that coming in to see a pain specialist can really maybe open you up to some ideas and some solutions. You talked a little bit about diagnostics too, and I think that's interesting, because from X-ray to MRI and probably a million things I don't even know the terms of, we've got a lot of ways to take a look at what's going on.
Yes, I think I feel like much of what I do is educating patients on what the actual pathology is. I think that helps to put people more at ease so they understand exactly what the problem is, and that may be through imaging and testing. And then we can talk about strategies to either manage what they have or to improve enough that hopefully some of these incidents may be short-term and they can move beyond that. So I feel that education is a big part of what I do.
Wonderful. And I think education is at the heart of what we're trying to do with our opioid reduction initiatives in both of our organizations. I think medical science as a whole is recognizing that we need a different approach to how we use opioids, because they do have a legitimate use. We just need to be far more aware of the propensity for people to become addicted, and we need to help that not happen. And I think dry needling is certainly a good example of that, but we have so many ways that we're able to help people learn to relieve what they're doing to their body that's causing pain, and also learn to manage pain and not have an expectation of completely pain-free.
Correct. Yeah, the expectation of saying I want to have zero pain is a little bit unrealistic. Like we talked about, 70% of people may have back pain at some point. I think historically, 15, 20 years ago, the idea was that, hey, we have these pain medications that can be helpful, and opioids were one of them. They said, just keep going up on it. If you have pain, we just give more. And that's a very simple explanation and understanding, and we found that it actually it often worsens people's functioning and pain. So correct, there are ways that opioids are helpful, especially for acute pain after surgery, but then moving towards non-opioid management, and there are a lot of things that we can do that are not opioid based. And I think people often come to my clinic and they think, oh gosh, I shouldn't have signed up for this. This is pain management, they're going to give me opioids. And they're usually relieved to find out that the plan has nothing to do with opioids and perhaps never will. But we try to get them feeling better without the need for medications. Now, medications do have a purpose, but there are a lot of non-opioid medications that can be used as well, in addition to the procedures and different therapies that we have to offer.
Fantastic. Gosh, Dr. Harrison, I appreciate you coming in. I think this has been really educational for me and for our viewers.
Well, thank you very much.
Great. You're watching Healthy Living. We were talking today about the neurosciences. We met 3 of the specialists who are part of Ochsner Neurosciences Institute at St. Tammany Health System. We hope you'll join us next time on Healthy Living.